Thank you for joining us this evening. This is the first webinar as part of our new Latent Heat campaign. And very pleased to have Spod with us this evening, doing a webinar about fibromyalgia. And this has kind of come about because Spod put together a case study for the latest Acupuncture Awareness Week. So he will be presenting that case study, and then he'll be answering your questions at the end. So thank you, Spod. Pass over
to you, Helen. Hello, everyone, and welcome. Hope you'll learn something this evening. And when we do the Q&A, I hope that I can learn something from yourselves as well. So I've been an acupuncturist for about 7 years now, and I've successfully treated a lot of chronic pain in that time. I've kind of distilled my training down to my own style. I guess most of us do that. I just guess I don't like following rules. I like to make up my own thing. So I've got quite a minimalist approach to treatment. So today we're going to talk about this case study of mine, but I'm also going to talk through the rationale that led me to treat fibro in such a way that's just been so successful for me. So this is the one case that's become a case study, but of course I've got many cases of fibro and chronic pain, etc., that I've been successful with. And also just to emphasize this, the rationale that I'll talk through today, and also the case study, that's the way that I've treated this patient, and this is the approach that I've used for fibro, and it's worked for me. It doesn't mean there aren't maybe flavors of fibro and chronic pain out there that this approach wouldn't work for, and maybe someone else's approach, which is completely different to mine, might also work equally well. But you know, this is my approach, and this is how I've done it, and this is what the case study is about. So I'm going to get the screen sharing going, and that means you won't need to look at my face anymore. So great. I guess you can all see the slide. So we're going to start off talking about this success story. So this case study is about the lovely Max, who's a patient who I got good results with her fibro, and the BACC asked me, well, after everyone, can anyone produce a case study for Acupuncture Awareness Week? And I thought it's a great case study, and Max gave her permission, of course, and she was interviewed by a journalist. I had nothing to do with the interview, and then actually I think pretty much the first time I saw it was when it popped up in the newspaper. So this was published in the globally renowned and Northamptonshire Telegraph. I think there's a paper version as well, but this was online. So this was it. Wellingborough acupuncture fibromyalgia patient brought back from the depths of despair, thanks to Stanic therapist. And she really was in the depths of despair. She was like an old shuffling lady when she first came to see me. Lots of pain. She had a stick. All she talked about was her pain and her troubles in her life. So this is the article, just copied and pasted in. I'm not going to read all of it. I'm just going to pick a few key points out. You can find the article yourself if you want to have or the story yourself if you want to have a read on the Northants Evening Telegraph. If you just search on there for Spod Dutton fibromyalgia, you should find it quite easily. If anyone can't find it, then just drop me an email and I'll send you a link, and there'll be an email address at the end. So Max felt pain in the whole of her body and could only walk with a stick. So she had this stick which turned into a seat, and she was really lost without it anywhere she went. And she had nothing to lose, you know. So that's often the way, isn't it? We're the bottom of the barrel. Everything's failed. Let's just go and try acupuncture. Oh, and it worked. So she had nothing to lose. So she came to see me. I think her expectations were quite low. She'd been to the osteopath, she'd been to the GP, and basically she was living on painkillers. She was taking the maximum number of painkillers that she was allowed to take, and it really wasn't working for her, as painkillers tend not to. So after the first session, she said the pain relief was amazing. She had basically pain all over her body. In particular, one of her biggest problems is she couldn't really move her head from side to side properly. A bit like, you wake up in the morning with a stiff neck. She had that all the time. And her medication was starting to take the pain away. So I'd relieved the pain to a degree so much after this one treatment that then the painkillers on top of that were enough to sort of, make her feel quite normal again. I'm just going to hide this gallery view. That's it. Also, her lower back felt much freer and she could stand for longer periods of time and she didn't need the stick. So I think she still took, so she still took her stick out, but no longer used it to help her walk. So if she had to stand and wait for a bus for 20 minutes, of course, she would take the stick. So she had a little seat. So that's the article. As I said before, this isn't a one-off. We've all been there. We've all had these results. But this is obviously the one that got into the news. So just to summarize on that, she was saying, I now feel so much stronger emotionally and I'm getting my life back. And then a few weeks later, this post dates the actual newspaper article. She could drive again because she could move her head and her neck sufficiently well that she could actually get back in the driving seat. So that was a massive change for her. So I'm going to call fibromyalgia fibro because it's much quicker. And we're going to go on a little journey of what I think fibro is about and how I treat it, and a bit more detail about the case study. So according to NHS, fibro has the following symptoms: loss of pain, increased sensitivity to pain, muscle stiffness, sleeping difficulties, which if you're in that much pain, of course, you can have sleeping difficulties, problems with mental processes, of course, you're in lots of pain. I think it's pretty likely you would not have the clarity of thought, headaches, again, another type of pain, IBS. I think people in lots of pain got a good chance that their innards will be upset a bit, and spookily, feelings of frustration, worry or low mood. So if you're in lots of pain, I think that's pretty likely that you're not going to be too happy. So these are the NHS symptoms. So we're going to return to those. So just kind of try and half remember at least those symptoms, what they are. So the causes of fibro, according to the NHS, are unknown. So basically, it's due to some stuff, and you might get it. That's kind of what that says. That's the shortened version. The condition may be triggered by things like physical or emotional, like injury, infection, or stress. How, according to the NHS again, how fibro is treated? It isn't. So there's currently no cure for fibromyalgia, but there's some things you can relieve the symptoms with, such as lifestyle changes, exercise, some therapy, some medication. And again, they reiterate about the exercise. I think anyone with any health condition could do with a bit of lifestyle change, some exercise, or most health conditions, and maybe a nice chat with people. Maybe not the meds, but who knows? So that's almost stating the bleeding obvious there. These things are going to help someone with that's not very well. So after treating lots of people with fibro and chronic pain, I've sort of developed my treatment approach based on experience of what was working and what I thought was going on at the physiological level. Although I'm a traditionally trained acupuncturist, we get trained in channels and chi, etc. That's half my brain. The other half of my brain is is physiology and mechanisms of acupuncture and research and so forth. So I do like to kind of see the both sides of things align. So this was the big question to me. Is fibro a separate condition? Is there a condition called fibro, or is it just a name for things that already exist? Is there an existing condition or some existing conditions that have been mislabeled as fibro, or not so much mislabeled, but a new label has been created that maybe was unnecessary? So my view is, so just to recap and to reiterate, for the people that I've seen in clinic, my view is fibro is just chronic pain, but chronic pain taken to the max, on turbocharged chronic pain. So if you think back to those symptoms given by the NHS for fibro, now if you think you've got lots of chronic pain, so you've got a frozen shoulder, you've got a neck pain, you've got a headache, maybe a bit of lower back pain and some pain in your hip that's stopping you walking. If you've got all those different pain conditions, you're going to almost guarantee to have those symptoms that were the fibro symptoms. You're going to have the muscle stiffness, because that's what chronic pain gives you. It gives you increased sensitivity to pain and lots of it. You're going to struggle to get to sleep. Your brain's not going to be working that well. You're going to probably get headaches, because if you've got a stiff neck, it's probably pulling on your scalp and causing headaches. All that muscle tension and pain in your body is likely to upset you, and of course, you're going to feel a bit low. So I think having lots of chronic pain gives you that alignment between fibro symptoms and what you'd expect from chronic pain. So if you went into your GP surgery and you said, oh, I'm getting migraines, I've also got my shoulders, it really hurts, I can't move it, I've got lower back pain, I've got some sort of sciatic pain, and oh, my jaw, can't move my jaw properly. The doctor's not going to say to you, oh, you've got migraines, frozen shoulder, you've got piriformis syndrome, and you've got TMJ pain. He's probably just go, oh, you've got fibro, nice and easy. So out of all of those, if you combine a load of those together, you can imagine being in a pretty poor state. So again, back to chronic pain. So really, I'm talking for chronic pain. Fibro for me, as I said a couple of slides ago, is just another label for chronic pain. Now, having treated lots and lots of chronic pain patients, so some have got one of those conditions, some have got two or three. There's a common, I'm going to call it an occurrence, so I don't give you a clue. There's a common occurrence that I have seen, not always, but all those conditions, at some point I've seen that condition with this common occurrence. And for me, that's what links them all together. So any ideas of what the common occurrence between all of those conditions could be? I think we've hopefully got a chat available here. Helen, maybe? Let's have a look here, the chat.
Yes.
Here we go. Lovely. Got the first one. I guess you can all see each other's. Yes. So blood and chi stagnation, repressed early life, anger and rage. Yeah, absolutely. So lots of stress and emotional trouble, stress again, trauma. I'll give you a couple of minutes to think and be brave and type something. Yeah. Oh, how appropriate. Latent heat. Spleen, yes. Liver's got to come up at some point, I guess. Liver, yeah. Wind. Thank you, Sarah. Okay, so we're coming up with all of the deficiency. So we're coming up with all the sort of classic conditions and kind of acupuncture syndromes. Now, my answer is completely different to those. I'm very practical, and in my minimalist approach, I don't use syndromes a whole lot. So let me just remove this chat again. Myofascial trigger points. I hope I haven't disappointed anyone. So all of these conditions, now this is a very physiological thing I'm talking about here. You might not expect an acupuncturist to start talking at this sort of level, but I work on all the levels, but certainly I do enjoy working at this almost scientific level. So myofascial trigger points. So a myofascial trigger point, which I'll call a trigger point from now on because it's quicker, is basically a knot or an archie point in our language. So it's a sensitive or painful area on the body, mainly on the posterior, so the shoulders, back, neck, in the gluteal area, but very deep. That gives you a piriformis syndrome in the calf muscles, etc. You very rarely get them on the front of the muscle, front of the body. I think it's due to the cause of them. So the cause for these knots is it's a kind of chemical reaction where the motor end plate, which is where the motor nerve joins to the muscle fibers. So where the motor nerve joins on, that connection is a synapse, which is a little gap. And when your nerve impulse wants to contract the muscle, it spews out a load of neurotransmitter chemicals, which bridge this little gap and cause the muscle fibers to contract. Now, with one of these trigger points, what happens is that motor end plate starts spewing out the neurotransmitter chemicals and doesn't stop. So this area gets tighter and tighter and tighter. Now, you've got a lot of sensory nerves coming out of the spine, straight into the back muscles, and I think that's possibly why you get them mainly on the back, because it's that close connection. Of course, you've got sensory nerves all over the body, but maybe it's something to do with the proximity to where they radiate out from the spine. So these knots are not like a ball, like a sphere of tightness as you would think of them. They're a taut band. And what they do is they compress their own blood supply, so they then get a lack of resources, so oxygen and nutrients. They also cause an increase in metabolism in the area, so they need more resources, so more blood, more nutrients, but they can't get them, so it's like an ever decreasing circle. And also, just to make it really annoying, they emit sensitizing chemicals that sensitize the pain nerves. So they'd hurt a bit, but they actually make themselves hurt a lot. That's why they're so bad. They cause serious referred and radiating pain as well, so it's not always clear where the problem is. And your kind of your whole back, if you've got these trigger points on your back, can due to the low level reduced compromised circulation, you'll get a vascular lymphatic circulation problem, which can lead up to a build-up of metabolites. So the whole area can just feel a bit grim and horrible. So all of those conditions that were on a slide a few slides ago, I've seen caused simply by these trigger points, and I've successfully treated them as trigger points, and I've had miraculous pain relief from patients in one treatment many times. I often joke with a patient saying, you don't believe this, but when you get to, this is treatment one, you don't believe this, but I know what's going on in your head at the moment. You're thinking, I don't believe him, but probably when you get off that couch in 25 minutes, you're probably going to be saying to me, blimey, that feels tons better. I didn't believe you. And it just happens time and time again. So literally, I have someone like that call it miraculous, or similarly extravagant word, probably 5 or 6 times a week. And I'm not a super busy acupuncturist. I work sort of three to four days a week. So how bad? Okay, so a trigger point. So it's a little knot. How bad can that really be? So yes, it can be very, very bad. So here's a lovely posterior view of someone's back. And let's say they've got 2 lovely trigger points, one above the scapula or on the scapula, and one in the kind of mid-thoracic back area. So they won't feel those little dots. They'll feel these larger areas of pain, and it'll radiate out. And as I said before, they won't quite understand where the actual pain comes from. Imagine if that's what they look like. They've got all these trigger points. Well, that's what the pain's going to be like. Pretty much their whole torso is going to be in pain. Their shoulders, their neck are not going to move properly. Their back, every time they move, it's going to be hurting, be tight. And as it gets worse and worse, it will spread, it will radiate out. It can go down into the hips, into the front of the thighs, into the gluteal area, and ouch. So, I think that's a good illustration of what a fibro patient can feel like, or chronic pain sufferer can feel like. It's just pain everywhere, don't know what to do. So hopefully my ramblings made sense to you there, or at least to some of you. I'm going to talk now through the case study in a bit more detail. I'm going to a little bit high level, then I'm actually going to talk through all the treatments. When I designed this originally, I wasn't going to go through all the treatments, but I'm actually going to, because I think it shows how I switch from effectively stick a needle where it hurts acupuncturist back to hopefully proper 5 elements acupuncturist. Got to keep a bit of credibility. So the patient came to me, presented with fibro. She's been in pain since her 20s, which was over 30 years ago. Who knows what the pain was in her 20s? It could have been something completely different, which might have got better, or it might have been the same problems which have escalated over time. Who knows? But when she came to me, I could see exactly what was going on there. So she had hip, shoulders and neck pain. She had ME, and she, as we said before, she walked with a stick. And when I treat chronic pain, I'm looking for trigger points. I do a lot of palpating, feeling for these trigger points, which, as I said, they present as taut bands, and you can feel them and they're very common in certain areas, but they can be sort of anywhere on the back. And I could hardly touch her. Literally, I started touching her back, and she was so sensitive. It was so painful that I thought, oh dear, I've got a problem here. But what I did was I kind of gradually went through the treatments, and you'll see in a moment how I got there. So this is just a recap here, that just to recognise that any chronic pain condition could be a localised injury or dysfunction, so some tissue that's damaged, or it could be a more systemic dysfunction. And all the things that were coming up in the chat there, all the syndromes, that's what I would think of as more of a systemic function. And it could be stress, and it could be emotional troubles, it could be a number of things. It could be one or the other, or it could be a combination. And in reality, most people have got a combination. But when you start treating a patient, I often think, oh, I could do this, and I could do this, I can do this. And, less is more in a treatment for me. So I want to focus on I think in college when we were trained, it was body, mind and spirit, and kind of that's what I like to do. I like to focus on one. And for Max, I focused initially on body. So for me, it seemed like chronic pain, palpated around, and I did find a number of these serious trigger points. So initially, I treated them with needles, and then once the sensitivity had gone down, I then went for some cups. And after a number of treatments, I then moved on to constitutional treatments. So this is the detail of the treatments. So treatment 1, very carefully needled 10 trigger point areas using 18 needles. That's a lot of needles. If I'm doing constitutional treatments, sort of 5-elementsy, I'll probably have 5 or 6 needles I use. If a person's got one bad trigger point, I might put 3 in it, maybe 4. So it's a lot of needles, but very carefully, I put them in. Quite often I will stimulate the needles, give them a good wiggle. With her, I didn't do that, certainly not on session 1. So she came back a week later for treatment 2, and she said, this is really weird. She said, my shoulders have improved. They're all tingly. I mean, some patients go away saying they felt a bit tingly, but she felt tingly for about a week. She was amazed with the benefits. And I'd also given her some exercises, some kind of neck stretching exercises and so forth. And she'd been doing those, which was great. So then I performed treatment 2, 20 needles in 11 trigger points. So again, quite a lot of needles, carefully. So the next treatment was 19 days later, because she'd been unavailable, busy doing things. But she came back, no stick in sight. She said that her first bad day was 15 days after treatment 2. So 2 treatments, 2 weeks improvement, which even for the standards of some of the good cases I've been successful with, that's a good one, considering how bad she was. So did treatment 3, which was 17 needles, 7 distinct areas on her back. So we've got less areas. Some of the points I'm putting more needles in, but it's less areas. That's good. What I find is, I think the lesser trigger points tend to ease off and disappear, and the bigger ones then become more obvious. I also put a nice bit of heat on her back with an infrared lamp. And for me, that's all about circulation. The trigger points are causing a compromised circulation, and the needles are helping those trigger points to relax, to bring the circulation back, and the heat as well will improve that circulation. Came back for treatment 4. I think this is probably still weekly at this stage. And again, continuing success. She said it was still great, still getting better and better. But now, after only 3 treatments, we've gone from can hardly touch her to I can do cupping. So this is what I call moving cups. So it's where you put a bit of oil on, got a squeezy ball with a glass cup part, move it around the back. And of course, you get a nice bit of bruising. I call it char, as in gua sha. Nice bit of bruising. 7 trigger point areas to need with 20 needles. On to treatment number 5. Still no walking stick, and her well-being had taken such a massive lift. She said that it felt like she had invisible armor, where the perils of the world around her, she was defended by this invisible armor, which I think is great. Just from putting needles in painful spots, she had this massive emotional boost. Now, was it because there's less pain, so you're going to feel better, or was it the other mechanisms of acupuncture giving her brain a good workout? And I think it's probably a combination of both. And she got less tired, still had to pace herself. So treatment, more cups, even a bit less char, 7 trigger points, 13 needles. Treatment number 6, still good, still working up. More cups, even less char. Now we're down to 4 main trigger point areas on her back, 13 needles. So I'm putting, quite a few needles in each of those points, because they're the bad guys. And there was one particularly bad point that I noted and mentioned to her, and she said, "Oh, that's my naughty bit." There's a bit of her back that's always been troublesome that she noticed more than anything. So we used to call that the naughty bit when she came for treatment. So on that area, after I'd done cupping, I'd done needles, I then put what I call a static cup. So a cup that you put in one place, pump it up and leave it for a few minutes. Put that on that spot there, onto the naughty spot. So she came back, all is great. So Max, we're now going to have some constitutional treatments. So I'm 5 elements trained, and quite often early on in the treatment, usually the first treatment, the sort of guidance is an AE drain. So an AE drain, for those that are unfamiliar with it, is some needles in some of the back shoe points, very shallow, maybe 1 to 2 millimeters, and you leave them for 20, say, to 40 minutes until any erythema, which is like red, nice tinge around the needles, disappears. And then I did heart 7, just tonified. So didn't touch the trigger points directly, but of course they're on her back, so these needles would be possibly adjacent to some of them, but completely different treatment. Treatment 8, still great, still very impressed. Bit of 5 elements again, bladder 43 on her back with some moxa, do 20. We all like do 20, and then her source points. And those are 5 elements trained people. If you remember back to the picture of her, do you think she was a fire CF? What do you think? I thought she was. Treatment 9, almost there, almost at the end. If you're falling asleep. Treatment number 9. Woohoo! She can drive again because she now can move her neck. She can look over her shoulder. She feels confident she can drive. So she was super chuffed. Her life is coming back to her. So the treatment number 9, more cups, almost no SHAR, all kind of gone. 8 trigger points, 14 needles, and the same naughty bit got its extra cup. So so she's had 9 treatments. Since I wrote this, I'm not sure if she's been again. I think she's in this week, so maybe this week is treatment 10. And I did pain scores. I take a pain score for most patients, not all of them, and I don't take a pain score every treatment, but I'd like to get them regular-ish. So 0 on my pain score is perfect, no problem. 1 is a bit of pain. 6 is pain is so bad you can't imagine it any worse. She was reporting pain of 5, which is pretty bad. After 2 treatments, she got down to pain 2, and that was when the walking stick was not required. And after 6 treatments, it's still pain 2, and after 8 treatments, she could drive. So now when I see her, she's a completely different person. She's relaxed, calm, optimistic. She seems more intellectual. She comes in and we talk about intellectual things rather than just her talking about pain and bad stuff and kind of shuffling and being all crouched over. So I think that she's going to be an ongoing patient, perhaps 4 weekly for the foreseeable. But I'm pretty relaxed that if she comes every 4 weeks, 6 weeks, misses 1, I think she'll still gradually get better and better because she knows that her pain is now surmountable. She's a lot more optimistic. And I think now if she has a little relapse, she'll treat it as a relapse and she'll come back and I'll treat her. So that's it. I think we're on to questions now. And so Helen, how do we do the questions?
Yes, if anybody wants to either put their hand up or they can put their electronic hand up by going into the reactions section. Or there are a few questions, if you can see them, Spod, in the chat for you.
Right. Okay. Okay. Right. And how are we doing for time?
Yeah, good. You're fine.
Good. Right. So I'm just going to look at the questions. Do you identify and treat underlying patterns alongside Archie points? I do to a degree. Some patients I will maybe not really treat the trigger points, even though maybe they've got some. So some patients, I'll do the 5 elements, AE drain and source points, and so much pain will go away. I might not feel that I need to directly needle the trigger points, or maybe I'll do 1 or 2 further on. So I don't have one size fits all, but I would say most of the time for chronic pain, I am biased towards the stick and needle where it hurts approach. Do you reduce the triggers or use even needling? What I do is the needles often have an angle on them, but I'm not thinking of evens and reducing. So sometimes a bad trigger point, I want to get as much needle. If you imagine you've got a taut band, I want to get as much needle into that muscle tissue as possible. So I might angle the needle because it's going through more muscle tissue. If I go straight down and it's, 4 millimeters deep, I've got 4 millimeters of contact. I've got an angle, maybe I've got 8 millimeters of contact. So I'm not doing evens or reducing as such. I'm just trying to basically abuse the trigger point as much as possible, give it some trauma. Do you recommend any trigger point map or book? To be honest, I've got a few and they're all good. Almost any trigger points book is good. You can get the charts, the diagrams of the body showing referred pain. They're quite good. So a patient comes in and says, "Oh, my calf really hurts." You have a look at the diagram and it says, "Ah, I need to stick a needle in his bum." So the diagrams are really good. And yeah, most of those books. I've got one that I forget the name of, and it's written by a physio, an osteopath, and it's really good. The Bible of trigger points was Travell and Simons, I think it was. They were osteopaths or physios, but they did a lot of science around trigger points. They did electrical conduction, all sorts of stuff. It's quite an old book, and you can maybe find it as a PDF somewhere online, but that's a really good one if you want to learn a little bit. But yeah, loads of books, and to be honest, they're all pretty good. Davis and Davis. Okay, someone's recommended Davis and Davis. I've not seen that one. Not acupuncture points, but acupuncture based. But thank you for the thank you. I need monthly treatments. Been having acupuncture for 9 years. I'm not sure if that's a request from someone rather than a question. What is your needling technique for trigger points? Okay, so what I do is, let's say I'm doing a simple trigger point treatment without any proper acupuncture points, any constitutional stuff. I will, so I'll palpate around. I'll find these taut bands. Sometimes you can feel it. You get a wiggler, so the area is quite a long, blobby thing, and you can literally ping it from side to side. And sometimes they're quite deep. You press, the patient says no, nothing, and you press quite deep, and you feel it. It just feels like a thick rubber band. And they go, "Oh yeah, I can feel now you're pressing." So what I do is I locate it. You want to get the center of this band. So sometimes I get my white body drawing pen and draw a line each side. So that helps with the middle. Now the problem is you've got to find the center. You can only really feel the trigger point as you're pushing it to one side. You've got to do that a few times till you go, "Oh, yeah, that's the center." And then you might draw another line. And then what I do is I might put the needle straight in, or might put it two at angles. Maybe I'll surround it and put one in the middle. Once they're in, I'll leave them for a few minutes. And then depending on if it's treatment number one for the patient and they're a little bit squeamish, a little bit sensitive, a bit worried, that's it. If they've had a few treatments or they're quite brave and I'm happy to give it some, then I'll get in there, I'll leave them for 5 minutes, then I'll give them a good wiggle. And maybe every 5 or 6 minutes I'll do the same. And when I wiggle them, when they jump, they go, "Oh," like that, maybe swear at me. That means you've got a bullseye. So that's what I say to them. That's a good thing. It means I've got a bullseye. Please let me know if it twinges, because if you hide it because you're brave, then that doesn't help me with the treatment. And you can be pretty sure the really bad ones, they're the ones that twinge. And if you get real bad twinges, I'll make a little note so that I'll make sure that I don't miss that next time, because that's a key one. I've got a comment here. Tai Chi recommended to fight fibro. Brilliant. To fight fibro, just to open it up slightly for a moment, trigger point needling constitutional treatment, lifestyle advice, exercise, massage, reading a good book. This is acupuncture. All of these things will all contribute to helping their fibro. I'm an acupuncturist and learned after getting success from my therapist, but need monthly treatment still 9 years on. So it sounds like for somebody, it's not working for them. Maybe. I'm not sure what that's about. Another one, emotions and emotional approach and avoidance strategies for fibro. Brilliant. I'll have a look at these, by the way. Thanks for giving me these. Do you combine moxa or heat lamp with trigger point needle? So heat lamps, yes. Moxa, less so. I could do. I do use moxa on the needle for constitutional work and moxa direct as well for constitutional work. I probably wouldn't use it on the trigger points because I want to be wiggling the needles and I'd end up burning my fingers, I think, and sending embers everywhere. But yeah, definitely a heat lamp. If you don't want to wiggle the needles, yeah, definitely try the moxa on the needle. That heat down into the trigger point might be really good. I haven't tried it because frankly what I do seems to work really well and it's sort of not broke. Okay, so what Sarah's saying, it works, assuming that means some treatment she's had, but it's not long lasting. My experience with treating chronic pain is it does last, providing they have enough treatment. So the typical pattern for me is, I would say most chronic pain patients is first treatment, they get up to go, oh, that's definitely better. Oh yeah, that's better, much better. Yeah, thanks. They come back, they go, oh, it was great for a day and a half. Then it got a bit worse again, but it's still better than when I came in first time. Then you do another treatment and it's similar, but it lasts longer and just lasts longer and longer. So each time they come back, they've had a tiny relapse, but nowhere near from when they were the previous session. And then once they've had maybe between 10 and 20 treatments, bear in mind that treatment 20 would probably be 4 weeks, 6, 8 weeks apart. Once they've had that many treatments, it will probably last quite a while. So I'll just quickly tell you my personal back trouble story. Helen, what time do we finish?
1:30, so you still got 45 minutes.
Loads of time. So very quickly, before I knew anything about acupuncture, I had a bad back and I discovered acupuncture from the point of view is, oh, I want to be an acupuncturist because I decided my career was killing me. So stopped doing that, went to train as an acupuncturist, but you have to have acupuncture first, don't you? I hadn't had acupuncture before. So I had a bad back, I was living with it. No cure, is there? And I had, I think, a couple of treatments before I actually then went and signed up for the course. And it got so much better really quickly. So a bit of cupping, bit of needling. Then I went to college. And once we got to the point where we were allowed to needle each other, which I think was a second year, or maybe we weren't allowed to, and maybe I'm just making this up. A fellow student used to needle. I had a naughty spot on my back. So it was kind of mid back, kind of halfway between my spine and say the middle edge of my my scapula. And you could feel it, and it felt numb and itchy. I had paresthesis, which is feels like insects under the skin. It was all sorts of bad stuff going on there. And I got needled quite vigorously, jabby, 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 lots of that, by my fellow student once a month for about a year. And that was once a month because that's when we went to college. And so I probably had, over the course of a year to two, I probably had 20 treatments on it over 2 years. And then when I qualified, I didn't need for at least 5 years. Well, it's been 6, 7 years, whatever, since I qualified now. And I've not, since I left college, basically I've had almost no treatment on it. I think I had one treatment about a couple of months ago. So I think I had about 5 years of no treatment. So that treatment lasted me for 5 years. And now it niggles a little bit. I do need a couple of treatments on it, I think. But, you know, does it last? Well, it has for me, it has for lots of my patients. Right. Do you use glass cups or those softer silicone cups? I use glass ones, which are the squeezy-ball ones for moving, and the ones that I don't move, the ones with a pumpy gun, they're plastic, but they're hard ones. Do you come across patients with all pains on only one side of the body? I have had patients with pain predominantly on one side of the body, for the ones that I've seen, it's just been that they just happen to have one-sided pain due to one-sided muscular problems or trigger points. And maybe it's because they're right-handed and they're doing a lot of driving, and the left-hand side is, you know, trying to balance their body, and that's where the problems have appeared. How many fibros have you treated over the years, and is this the protocol that I use? So it's not so much a protocol, but it's kind of a style that I approach. I do adapt it, but it's broadly start with needles, then move on to cups. Well, then I'll move on to moving cups, then move on to the static cups, maybe a heat lamp, and at some point I'll put constitutional stuff in there. It might be early on, or I might mix it up. I might even do a bit of both as I go along. So I might do source points and a bit of cupping. And how many fibro patients have I treated over the years? So I'm going to call them chronic pain because I'm calling them the same thing. Chronic pain treatments over I would say probably individual patients, probably at least 100, maybe 200, something like that. Nearly all of my patients seem to be people with pain. Okay, let's catch a plane. Don't miss the plane, Claire. How much would trigger points help blood in TCM terms? Asking to use massage as a way of treating blood would help emotional stagnation at the blood level. It seems. I frankly don't use those terms that very much. Sorry, you know, it's part of my training, but I don't use syndromes a whole lot. They don't really guide me. I've got my own distilled approach, and I don't really use the TCM terms. Do you do Akabani correction with fibro patients? No, Akabani is one of the things that I distilled out of my practice. I just don't use it. Did your patient Max make any lifestyle changes at the same time as having treatment? No, not really. No, there was nothing significant that changed in her life, as far as I know. Patient with fibro is large and find difficult to palpate the tight edge because it's painful to touch and press down. Okay, so I'll read this one out. I have a patient with fibro who is larger, and I find it difficult to palpate for tight areas because it's painful to touch and press down to the muscle area. Any tips? So what I would do is, if you can get any improvements, then you might be able to reduce that sensitivity. So what I would do is, instead of trying to find the trigger points, because you might, as you've said, you might not find them, just gently palpate the back. And whenever the patient says, yeah, that's painful there, gently draw a little circle. The circle might be that big. And then just keep feeling around and try and get the epicenter of where the pain is. The patient will go, oh yeah, I think that's worse there. So what you're doing your best guess at where the trigger points are. So you might get 6 points, and then needle, again, if they're very sensitive, needle to the depth that is obviously both safe and also hopefully penetrates the muscle tissue, because if they've got a fat layer, you need to obviously estimate where the depth between that and their fibro. I'm assuming it's there on the back. You need to obviously estimate where the ribs are, so obvious reasons. So try and guess where the trigger point is from this palpation, and then needle through and just try and get into the tissue. Obviously err on the side of caution. If these four, say you found 4 points, if you get the needle spot on 2 of them, and one of them you miss because you just missed, and the other one you missed because you haven't gone deep enough, you've still needled 2 of them. Tell the patient, yeah, it hopefully will get a bit better. Tell them it could take 10 treatments, and hopefully they'll come back and you'll get a little bit better. And then as it gets better and better, you'll then be able to go a bit deeper and feel around. How do you use source points? Low points. I use a mixture of traditional points and traditional combinations of points. But for chronic pain, I'm usually doing trigger points and cupping, and then I'll probably then introduce sort of what I call basic 5 elements using source points and maybe an A drain, that sort of thing. I do like using points in these sort of combinations. I'm not a fan of having overcomplicated protocols, though. Are there any foods or vitamins you suggest for your patients? I've got a brilliant approach to this, because I'm not an expert. I just make sure they're eating plenty of vegetables. that's my approach. So I could potentially learn more about vitamin deficiency and maybe get them to have some tests and things, and be more targeted. But generalizing, if they've got a really crappy diet, I will suggest they improve their diet rather than looking at supplements, really. But it's not my expertise. Oh, bye-bye. Someone's just got to go. I think that's probably the end of the questions. Any other last questions? Or it does sound as though you're working with blood. Oh, you cup it, yeah. So okay, back to syndromes then. So I'm sure what I do does work with syndromes, and there are syndromes. I am tackling syndromes as the underlying cause, but I'm not intentionally choosing to tackle in a syndrome way. Syndromes are, for me, a way of grouping conditions, symptoms together to categorize an illness. So yeah, too right. I'm inadvertently using syndromes, but it's just a way that you're using to describe a condition. For me, that's what a syndrome is. It's not a thing itself. It's just a grouping, and that's fine. A lot of people obviously have a lot of success with them. Pain conditions have generally to do with inflammation. I wouldn't agree necessarily that they're all to do with inflammation. Inflammation's ravages some people's bodies, some people maybe doesn't. So I think inflammation could be an aspect for some people. Usually recommend turmeric and garlic as anti-inflammatory. Yep, that sounds like a good plan. I think that's a good thing. Or just eat lots of curry. That would be my recommendation. Okay, Philippa, you're very helpful. You're welcome. Chronic fatigue is a main symptom with my patient. Do you have any advice apart from CF work? No, I don't, unfortunately. I think that would be my approach. Do your usual constitutional stuff for chronic fatigue. Yeah, that would be my best guess. Okay, yeah, more about working with blood. Yeah, that's all relevant stuff, working with the medium of the system. Yeah. Okay, Fatima, you're welcome. Many thanks. Interesting approach to fibro. Yeah, thank you. It is an approach, and as I keep saying, there are many approaches, some of which will probably work equally well. I'm sure you could send some of your patients to me, and maybe my approach wouldn't work, but your approach did.
I think that might be all the questions, unless there's any. Oh, I've got one more. Does it ever not work?
Does it ever not work? The only one time that I can remember it not working was my first fibro patient was an old friend from school that I'd seen on Facebook talking about her fibro a lot. And I thought, oh, I'd love to try treating fibro because it sounds untreatable. And she came along. I messaged her, I said, you interested in some treatment for acupuncture? Yeah, remember me from school, sort of thing. And I'll do it for free because I just want to treat someone with fibro. And I treated her purely, so this is going to be a bit upsetting for some people, purely using constitutional 5 elements treatment. She had a lot of treatments and she felt a little bit better, but that was it. It was pretty much unsuccessful. And that was what led me to start thinking, what's going on there? And that's when I came down on my little fibro journey. So other than that, if I have my toolkit of both constitutional and lots of physical trigger point treatment, I can't think of any patients that have haven't got either a little bit better, or no, I'd say they all significantly get better, or they get miraculously better. So it's worked very, very well. So I'm going to apply it to their patient. Brilliant. Do you have any thoughts on peripheral neuropathy? I do. So I think acupuncture can be really good for that. I think you've got to give a lot of treatments though. There is some research around that, and as it happens, bit of a coincidence, I was just recording a podcast today with a chap called Matthew Bauer, who's part of the Acupuncture Now Foundation, ANF, and it's on peripheral neuropathy and acupuncture. And there's a load of good research, and apparently it can work really well, but you have to have lots of treatment. You have to have 10, 15 treatments. So just at the point where most people would give up, oh, I've had 8 treatments, it's not working. That's at the point where it might start working. I have treated peripheral neuropathy a bit with modern, I would say minimal to medium amount of success using electroacupuncture. But I think after that, I've learned today on the podcast, I think probably we gave up a bit too soon. I've gone for the 6 treatments, give it up as a bad job. So I need to read that research myself, but yeah, I think it's definitely an avenue to explore. Lots of thank yous. Thank you for the thank yous. I'm considering running a training course for treating chronic pain. So if anyone's interested in that, drop me an email. So I'm potentially looking at doing one in June or July. So Lynn is saying, I've treated peripheral neuropathy very successfully. Keep going. Good, good. So Lynn, how many treatments before you got a noticeable improvement? Hopefully she'll respond here. If you can remember. Not everyone can remember. Thank you. Pushing the needling technique. Most likely located in my home clinic, which is in Stanwick in Northamptonshire, which is not far from Kettering, Wellingborough area. Oh, some people 4 to 5 sessions only. Okay, that's good. And is that diabetes-based peripheral neuropathy or some other reason? Or shingles or diabetes mostly? Yes. So I think the research that I haven't read yet, but that I've been told about today was diabetes related. I think one of the cases that I can remember didn't work very well. That was shingles related, and she'd waited probably nearly a year before she came to see me. So that was probably maybe shingles, or maybe she leaves it too long. It's never going to fix it. But diabetes, maybe that's a good chance. A great practical approach. Always struggled with treating fibro. Traditional chi blood approach. Yeah. I mean, in a way, I'm kind of just basically sticking a needle where it hurts, but there's a little bit more to it than that. But hope it's not not too many people think I've just gone to the dark side of just stabbing the sore bits. Like to see it reframed in physical terms. When clearing damp helps with neuropathy. Okay, good. Enjoyed this. Reassuring this kind of way. Feel sensible for treat. Do post if you run a course, although later in the year it took me personally better. Interested in the course as long as the dates align up. Okay.
Right, so I think we might end it there if we've got any more questions, or if there's anyone that's got any questions and don't want to ask whilst the recording's on. When I stop, you're welcome to kind of just stay on and ask Spod anything.
Yeah, I mean, I'll hang around until everyone's gone. Then once I'm Billy No Mates, I'll go. Should have bought myself a beer up.
Well, I will stop the recording now, but just want to say thank you very much, Spod, and see clearly from the comments in the chat, it's will be very kind of greatly received. So thank you very much.
You're very welcome.